Hello, I am Dr. Ann Pendo, the Senior Medical Director in the Office of Patient Experience at Intermountain Healthcare. Today, I'm here with Dr. Kristin Dascomb. She is the Medical Director for Infection Prevention and Employee Health at Intermountain Healthcare. We're excited to hear about her leadership journey in the time of COVID. Thanks for being here, Kristin.
Oh, thank you for having me. I'm very flattered.
Oh, it's great to have an opportunity for us to catch up. Kristin and I work in the same department, but haven't seen each other for almost 2 months. And so it's nice to see you face to face, even though we are physically distant.
And we miss you. My goodness, it's always nice to have such wonderful colleagues to be able to spend time with. It's definitely
been great.
Definitely nice to spend time again.
So we're happy that you're here today, and I'm anxious and eager to hear you talk a little bit about how your role was before the COVID pandemic and how it's really changed. You've really been thrust into the spotlight of leadership, and tell us a little bit about what your professional life was before and what it's like today.
Well, I was a leader in the Office of Patient Experience. We ensure that our patients are safe on a daily basis as it relates to infection. So we provide the processes, the personal protective equipment, and we make sure our caregivers and our patients are safe. And usually it's sort of runs under the radar unless there's a problem, in which case we help solve them along the way. We also resolve regulatory issues to make sure that we're meeting those kind of guidelines and make sure we're providing the best care that we can. When this illness was first being noticed, we recognized early on that it was a coronavirus, that it was likely related to many of the other coronaviruses we've seen, such as SARS and MERS. And in many cases, those were frequently spread by their healthcare workers. And so immediately we recognized the forefront we would be thrust into just because that was going to be such a large part of the care that we would potentially be providing. And so we wanted to, number one, make sure our caregivers were safe. And that fell squarely on our shoulders, and we wanted to make sure we were very aggressive and make sure not only that we had the proper equipment, but also had guidelines and clear guidelines as to how to use that properly and make sure that our caregivers not only were safe, but felt safe, both of which are important and very hard to achieve in a very short amount of time.
Yes, I think the thing that has impressed me the most is the rapidity of change. And at the onset, it was really you would send something out on day one and it could be changed by the afternoon or the following day. And how did you step into the need for that constant change of information?
Yeah, there's a lot of things that occur with that. One is the pressure on your teams. We're used to working at a certain cadence. We're used to working together as a team in certain ways. The pressure accelerated because we had so many changes to deal with, how we dealt with them, how we sent out the information, because that changed rapidly, and then how to modify that information in a clear and concise manner so that not only we were not confused, but that we still felt safe about those decisions. Very challenging. It also, on the flip side to my team, provided a lot of fatigue. So we had to balance priorities very carefully, time management very carefully, and yet ensure that we were still providing safe and comfortable messages.
Yeah. It was a lot of uncertainty during that time. And I had the sense that you had a great sense of responsibility for making certain that we were safe, the messages were clear, and being available to message that and really share that knowledge.
Well, and I think our jobs, as I mentioned, is sort of fly under the radar for the most part. We have a lot of caregivers that do a lot of very important work, whether they're frontline, our EVS workers who clean our rooms and keep us safe, to our phlebotomists who interact with our patients so frequently and try to make them feel as comfortable as possible. And we're just in the background making sure a lot of things are going on that are keeping the whole thing running. This really forced us to stand forward, to speak loudly, to speak clearly, and to have a voice in that conversation. That was unusual for us.
Yeah. So I'm curious to know what you learned about yourself not just as a physician, but as a physician leader?
I actually came to a stark realization, something that you taught me a while ago, and I should have listened a while ago. As a physician, as an infectious diseases physician, I'm very much a fixer. I learned very quickly that you ask me a problem, I figure out a path to resolving that problem. This situation was not that role. This situation is we have a larger, bigger picture problem. Many of those issues I have a hand in to support you in making decisions, but I can't fix or I can't change that problem outside of helping you with giving information that can help you make decisions. And so recognizing either my role as a delegator, a supporter, a data gatherer. I mean, there's lots of different pieces in that, or time organizer even. There are many days that we spent where I spent days in meetings where I was literally just getting asks from people. I didn't have time to do work. I literally just get asks. And so organizing that time effectively was another skill that I had to really develop well.
What about at home? You've got a husband who's a physician and a young school-age child. And what did you learn about now that you really were front and center in this work? How did your home life change?
I think my daughter really likes me working from home. I'll say that. That was very nice. However, I had to adapt to the idea that my daughter likes cameras a lot more than I do. And so understanding that I was not always going to be in this very professional moment, that mom was a part of my personal and professional life, whether I liked that or not, had to be comfortable with that. My interaction with my husband was a little different just because he saw me very differently all of a sudden. Previously, we'd gone to residency together. We were coworkers and, we were always having fun. And now he's like, well, wait, you're fancy now to some degree. I mean, he felt like there was some difference suddenly. And I was like, no, it's the same thing. And we had to reconcile that to some degree, which I thought was funny. I don't know why he'd ever think that, but there was definitely a moment there that he made that realization. So yes, there was definitely some differences. And I've had some really sweet moments with my daughter where she said, you really should be proud of what you're doing, which I never thought she would ever think that, but I think she recognizes that we're spending a lot of time as a system. I mean, I'm not saying myself, I'm saying everyone is really working together. We're spending a lot of time to make sure our patients are safe. And I think she recognized that, and I think she was pointing it at me because I'm the one she sees, but I think it's all of us. It's not just me.
She's old enough to understand.
She's 9, yeah, definitely. She
what
sees,
this means.
Yeah, and she has her frustrations, so in the same way we all do. But at the same time, she recognizes that what we're doing is very important for all of our safety.
Yeah, I think that's really nice for your daughter to have a role model. Kind of seeing you in a different way than she's seen you before. And I know that when my children were little, they didn't really understand what I did. Now that they're adults, they've got a deeper appreciation. So I think that that's really wonderful. What do you think you're going to do differently going forward? I mean, at some point, the rapidity of change and we're going to settle into a new rhythm. I'm not going to use the word new normal because I don't know what that means anymore, but we're going to settle into a new rhythm. And as you think and reflect on that, what are the things that you're noticing?
In healthcare specifically, I think, or you're talking about my style and my role? I
think probably both. I think it'd be interesting to hear your perspective on both aspects.
Sure. In healthcare, I see us having rapidly adapted to a lot of new aspects of care. One is certainly telehealth. We've adapted to that rapidly with the payer changes as well as the need for safe and effective care. I've seen adaptations to utilization of different forms of care, or using our testing sites, which is drive-through, something we would have never, for patient experience, ever considered. And yet the feedback that we get is remarkable. People really enjoy that and really appreciate the safety that they feel, but also the convenience that they feel. So we're seeing things and innovations that we otherwise wouldn't have even maybe considered that came out of something like this that we'll probably see as a part of caregiving in the future. In terms of my role and my personal space, I've definitely learned that, as I mentioned, I've always been a listener. I'm one who absorbs the information from a lot of different places, formulates a decision, and helps people make decisions. But I've learned that I have to be a lot more outspoken when I need to. I need to put my words on the table and move forward, and that's important as a part of all this. That's a big change for me, being a very, like I said, a listener and someone who sort of has been in the background to some degree. I think there's also going to be a larger space for infection control in the future. I think I think this is one example, but in the future there will obviously be more other examples. And while Ebola was a scary one, it was much more contained. We had a moment where we've really set up specific arenas to be able to take care of those folks, but we never imagined the volumes that we were dealing with here with respiratory illness. And so I think infection prevention and emergency management, will both be a huge part of our future planning, whether it's for a flu pandemic, another episode like this, or whatever new potential pathogens may be around the corner. I think we'll in the future be much more prepared.
Well, I do think that this whole experience has taught us that we can do hard things.
Oh, yes. And quickly and adapt. And I think innovation is the other good one, too. Many things that we felt were, again, off the table, we innovated and figured out ways to adapt our PPE to our utilization so that we're keeping ourselves safe, but at the same time managing to reuse or continue to use or even reprocess now, which we would never have thought of that in the past. It's wonderful to see these sorts of adaptations so rapidly.
Yeah. As we wrap up our time together, is there anything that you might want to share with the audience that you've learned as a leader, or in times of rapid change? What advice might you share?
I think being innovative and adaptive is our biggest strength. I think recognizing that as we make these rapid changes, that we do need to prioritize our time as well as the time of our teams. Yeah. I feel, from both me being on teams as well as my teams underneath that work with me, we determine that we have important things that have to get done now, and everyone has their priority. And when it's a large system like this with a lot of different moving parts, everyone's priority feels very, very important and very high priority. And you have to be able to make those time changes so that we're not over-pressuring small teams that really need to be able to make careful and metered decisions. And still be able to maintain their lives, because it can get very hectic. It was very hectic from January through March for our teams, and we really had to manage that carefully to make sure we were making the right decisions.
Yeah. And that you didn't get so exhausted that you weren't able to be functional through this new phase.
Or even that we didn't get so exhausted that we weren't making kind and comforting decisions. You can make the appropriate decision even sometimes. We're trained for that in medicine, right? Yes. We go to residency and stay up all night and then still have to make appropriate decisions, but that doesn't mean we're necessarily kind or comforting when we do it by that time. We really need to make sure that those who are working with us, we're still keeping that component of these folks are scared. They're terrified about getting illnesses like this, and we really need to make sure that we're not only giving them the sound advice, but we're also giving them advice that they can utilize to help manage their fear and manage what they're doing and really give effective caregiving themselves.
Thanks. I think as we end our time together today, the things that I'm taking away is the importance of having a strong, clear voice with kindness, looking out for your team, paying attention to those around you to see how they're doing, and not be afraid to try new things, see how they work, innovate, readjust, and new things forward. So thank you so much for taking the time out of your busy schedule today and joining us for this conversation about leadership in a time of significant change. Thank you.
Thank you very much.
Thanks for joining us today. We'll look forward to having you join us again with our next LinkedIn Live.